Psoriatic arthritis is a chronic inflammatory disease that affects up to 30% of patients with psoriasis. Manifestations of PSA include peripheral arthritis, axial disease, psoriasis and nail psoriasis, as well as dactylitis and enthesitis. Enthesitis, which develops in 60 to 80% of patients, is associated with joint damage, and early detection and treatment are essential to management of the disease. Enthesitis is defined as the inflammation of the entheses, the area where tendons, ligaments, or joint capsules insert into bone. It is one of the first signs of PSA and has been proposed to be the primary lesion of the disease. Identifying enthesitis is greatly important as it can lead to early diagnosis and treatment initiation in these patients with PSA before irreversible structural damage occurs. This review describes imaging techniques used to detect enthesitis and discusses ways in which standardized definitions and validated scoring systems allow for a more accurate assessment of treatment. Historically, enthesitis has been assessed using a combination of clinical examination and conventional radiography, which are non-invasive, inexpensive, and relatively fast. However, they do not provide complete information on the extent of enthesial involvement or the presence of subclinical enthesitis, which are better assessed using techniques like ultrasound and MRI. Ultrasound is inexpensive, non-ionizing, and non-invasive, and produces real-time images at the point of care. It can detect both acute and chronic inflammation or changes, but there's currently a lack of guidelines regarding Doppler settings, and standardization of settings on different machines is challenging. MRI can be used to evaluate axial or peripheral entheses and can provide high-resolution evidence of soft tissue abnormalities, but it is more expensive and time-consuming than ultrasound. New imaging techniques are also being developed and validated, including dual-energy CT iodine mapping, PET-CT using fluorodeoxyglucose, and immunoscintigraphy. Of these, ultrasound is the most widely used modality to assess enthesitis, and two main ultrasound scoring systems, the OMERACT and GRAPPA scoring systems, have now been developed. In this short video, I will demonstrate how to examine the enthesis of the Achilles and show you what features we typically look for. So the next enthesis we'll examine by ultrasound is the Achilles. You notice that I've placed the patient prone to have better access to the back of the ankle, and I just let them sort of relax, hang neutral in that 90-degree position. You can, if you want to, bring out grayscale abnormalities, have them dorsiflex the foot. So I'll say if you can bring your toes a little bit up to your head. There you go. That does put a little bit more tension on the Achilles. Here again, I've changed my machine settings to ankle. And what I'm looking for here, enthesophytes at the distal calcaneus, distal insertion of the Achilles, and oftentimes erosions are seen here more proximally. This would be the region of a retrocalcaneal bursitis if present, and then you can relax down again. And so once you are satisfied that you have examined thoroughly throughout the enthesis medially and laterally, capture a representative image, then you can turn on Doppler signal. Again here, pardon me. And make the region of interest box a little bit more narrow, but making sure to scan through the entire enthesis medially and laterally. Saving again a representative image. And once again, I'm not setting the best example for you, just making sure to apply as little pressure as possible. If you can't actually see the layer of gel, that's fine, but just remember to have a gentle hand. So last but not least is going to be the plantar fascia. For this ultrasound examination, what you want to do is try to, again, capture your grayscale beam mode, adjust your focal points down as necessary, looking again for that same hyperorthogenicity thickening. So here calcaneus, here plantar fascia across the length of the screen. It is difficult often to appreciate this because you're going through thicker plantar fascial skin. One little trick is to drop your frequency. So here I'm dropping it down to 10 or even 8. You see how that has more tissue through penetration and can give you more resolution of the represented structures there. Scanning medially and laterally. And there again, once you're done, moving on to B mode. Another little trick is to leave gel on the plantar aspect of the foot for a long period of time. Once you're happy then with your grayscale, then you can capture a power Doppler image using as little pressure as possible. Fantastic. As you have seen, imaging modalities allow for direct visualization of the enthesis and related structures and offer the potential to systematically assess enthesitis earlier in the disease course, possibly leading to improved patient outcomes. Despite this progress, there is currently no gold standard imaging technique to detect enthesitis. Ongoing studies, such as the Phase 3 Achilles and Ultimate studies, are evaluating the utility of ultrasound and MRI for the monitoring of enthesitis in PSA. Additional clinical trials that focus on treatment of enthesitis and use imaging as a way to monitor the effects of treatment will allow the efficacy of new therapeutics to be assessed and compared.